how can we deal with the mosquito problem? Certainly big uptick. And that's the sort of jokey, fun side of things. And I'm sure we'll all come up with some different solutions for the mosquitoes. But there are actually concerns that cases of dengue fever seem to be rising in the country. That is despite it previously being very, very rarely reported in the Emirates. Several doctors here have suggested that they are seeing increasing cases of the tropical disease. The link, obviously, to mosquitoes is that it's spread by mosquitoes. And certainly a number of Arab nations have reported a real uptick over the sort of last 2 decades. It's up 88% in the MENA region between 1990 and 2019. Now, essentially, dengue fever is a waterborne disease and it can cause serious illness. So why might we be seeing more cases right here in the UAE? Joining me now to tell us more is Dr. Syed Nadir. He is Medical Director and Internal Medicine Specialist at Adam Vital Hospital, AT Adam Vital Hospital. Thank you so much for joining us, Dr. Nadir. How are you? Good morning to you.
Hello.
Hello, hi.
Hello, good morning to all of you.
Good morning. Tell me, what is dengue fever? Why do we need to be worried about it?
Yes, it's been there for the last couple of decades, but what has happened now from the last, let's say, 10, 15 years, the number of the cases has increased tremendously, and it's not in this part of the world. Overall, worldwide it has increased from a few hundred thousands 10, 15 years back to now it's reached to more than 5.2 million. So that's, we can see the increased number of the cases. That's what happened. So one of the things that rings to the bells that why the numbers are increasing. So there are multiple reasons. One of the most common reasons is the climate change. Global warming is one of the reasons. Excess tourism, people going from one part of the world to another part of the world frequently has increased the dengue fever. Basically, dengue is specifically, if we are talking today, it's one of the viruses, basically called flavivirus, which the mosquito carries. So not all the mosquitoes have dengue. It's a common misconception. If we are being bitten by the mosquito that we will have dengue, no. Some mosquitoes, namely with the family, of course, like Aedes aegypti, and the virus is flavivirus. So once the mosquito have this virus, and it can easily transmit this disease, what we call is dengue.
Can I ask you something? Get dengue, can I give it to my family, or do they have to get it directly from a mosquito? Is it spread human to human?
Yeah, it's a very good question. This is the point. If you are being infected with dengue, and if the mosquito bites you, the virus can easily be transmitted from you to your family.
Oh, it can. That's worrying, because that means it could spread, from an adult who can handle it to a child or an elderly parent quite easily. What does it actually? Yes. What disease does it cause? What are the symptoms?
The most common symptom for dengue is fever and headaches. It's normally after you're being bitten by dengue virus, you will have an incubation period of 3 to 7 days. You won't have any symptoms. But after, let's say, 4 to 5 days, the first symptom which normally we see is the fever, which it goes as high-grade fever and along with the headache. But of course, you will have other symptoms that start from severe body pain, malaise, severe weaknesses, nausea, abdominal pain. Diarrhea is less, but most of the general symptoms which start with fever and headaches, and it goes worse for the first, let's say, 6, 7, 8 days. And then later on, when our immunity works it out, it goes back towards normal within the end of the week or 9 or 10 days. But most of course, what happens is sometimes when our immunity is not good, when we have children or elderly age group, sometimes this went from mild infection to a moderate or a severe infection. So that's where they have to visit the doctor, and then there certain kind of treatment has to be taken care of.
So there is treatment for it, and you can, most people recover from it quite happily. Have you seen an uptick in cases in the UAE?
Well, till now we don't have any official data from government that how many cases we have, how many cases has been reported. But yes, we have seen even in the emergency departments, because we are dealing in talking with other hospitals, ER also. So it came to know that yes, the cases has increased, not tremendously, very good that it's not increased to a level, but yes, the cases we have reported, like for example, once we used to report only 4 to 5 cases or 10 cases a year, now it has gone to 20 to 30 cases a year. But most of them cases are mild to moderate cases which doesn't need hospitalization. Only few percent of the cases which was, I told you, immunocompromised patients and who have any history of elderly patient or sick patient, they will go to the severe illness and then they will need hospitalization and certain specialized care. But in general, it is taken care by the immunity, normally takes it by itself. But the most problem, what happens is, if you have heard the name platelets, these viruses, they attack on the blood platelets. So what are the platelets? Basically, we have to understand the platelets that will help to stop the bleeding in our body immune system. So once the platelet levels goes down, there is an increased tendency of bleeding. So that's what happened. The first symptom in severe cases, you start to see there is a gum bleed. You will see bleeding from urine or all small areas. You will see start bleeding. So once again, these are the severe cases we are talking about. But majority of the time, it remains between mild to moderate with fever, headaches, body aches, arthralgias, and within 7-8 days, it start to settle down.
Okay, so say there are a few more of these dengue mosquitoes flying around. How can you protect yourself from catching dengue fever, both here or if you're traveling around the rest of the Middle East or into Asia?
Yeah, so as you told earlier, the best way is to have the terrorist racket with you if it's possible. Number one. Number two is mosquito repellents. We have, you go in the market, you will find different kind of mosquito repellents. They are good. They are doing a better job. Of course, the smell is not very nice, but that will help. Long, loose clothes, they're helpful. If you have any pond of water outside, that needs to be taken care because they are the main manifestation where the larvae grow of this dengue virus. So make sure these things are clean. So these small precaution needs to be taken care of. If you fear of dengue, if there's an increased chance of getting dengue, the one area where we can see most dengue are the green areas. We have gardens. So that once again, that make sure that there is no remaining water in the ground. Once again, sometimes there is a remaining water, a small pond of water there in the garden area. It remains there for 24 hours. So that could be a good manifestation also for the dengue virus on the mosquito to grow their larvae. So once again, those things needs to be taken care of. And
Can I ask you just something very quickly? You said just if a pool of water was just there for 24 hours, is that long enough for mosquito larvae to hatch, to be laid and hatch?
It's not like, yeah, it's good enough. They can hatch and so that's a problem. So once again, make sure that the surface should be clean and dry. So that needs to be done. Yeah.
Absolutely fascinating conversation there. Certainly, I'm going to be getting out the, well, we've got one of these roll-on sticks that I've been using around my ankles, and that does seem to have some effect. But you'd think that the smell of it would drive them away, but they still seem to be able to target the one bit of my body that I have failed to put mosquito repellent on. And I refuse to put it on my face. I'm not putting DEET on my face. But really lovely to have you join us on the line. Thank you so much for that clarity regarding dengue fever. You've just been hearing the voice there of Dr. Syed Nadir, who is Medical Director and Internal Medicine Specialist at Adam Vital Hospital. Thank you very much indeed for your time this Thursday morning. And, I'd love to keep, please do keep your comments coming about sort of potential solutions for getting rid of the scourge of mosquitoes that I'm sure everyone is currently struggling with.